Good evening, everybody. Welcome to Radio Regent. And my name is Murshida. I'm one of the Regent Park ambassador. And I have Abhishek with me from Health Center. Abhishek, can you introduce yourself?
Thank you, Murshida. Hello, everyone. My name is Abhishek. I work with Regent Park CHC for over a year now, and I am pandemic program manager looking into all the vaccination efforts from Regent Park CHC and in downtown East.
So, Abhishek, we know that the COVID exists for past 3 years. We've been isolating and we've been in the lockdown and all this stuff. So, can we just go over a little bit about on the COVID and how to protect ourselves when we have our COVID?
Right. Thank you, Murshida, for that question. So, I do understand people are tired, sick and tired of
Yes.
COVID, clinics, information, vaccines. So, I think everybody knows what COVID is. I'll just touch base on it quickly. So, COVID-19 is an infectious disease and it spreads by a virus. And the symptoms include fever or chill, cough, shortness of breath, difficulty breathing, fatigue, muscles ache, body ache, headache, loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, diarrhea. These could be some of the symptoms of COVID. And it does affect older adults or people who have more underlying conditions and have comorbidities like heart condition or lung condition or diabetes. They are at higher risk of developing more severe complications from COVID-19 illnesses. So I hope that helps.
Yeah, it does help. So, like, we know that, like, as a person like me, I know when I had a COVID, I never had symptoms. So, what are the things that person who doesn't show symptoms? What are the things they can look after?
So it is possible that people can be asymptomatic. However, there could, because this is an infection, it could also be very minor symptoms. So probably just coughing, a little bit of fever, a little bit of headache. So it is correct that people can be asymptomatic, but that's definitely a challenge to identify who is who is COVID positive, right? Otherwise, in general, people do have symptoms, and when they get their testing, right now, the best way of testing is using a rapid antigen or a RAT kit, and that confirms the diagnosis. With evolving strains, also like as we are learning more on the virus is also learning more and evolving, right? So the confirmatory diagnosis is through different measures. A RAT test is the easiest one. Another one is through a machine which does molecular testing. It is called ID Now. And the third one, where the swab is taken from nose and mouth. That are the three common ways to conduct tests. So these help in identifying if the person has COVID. But right now, the guidance from the government is if you have any minor symptoms, consider you are positive and start isolating yourself so that you do not spread infection to your family and friends.
Okay, thank you. Since you said antigen, so does this still available to people in the community for free of charges?
So there is a criteria for PCR testing. If you are eligible, yes. Otherwise, now the guideline is even if you are considered positive on a RAT test, which is the RAT kits are freely available throughout, you assume that you are COVID positive, right? So if you have symptoms and if you're positive on RAT test, assume that you are positive and then start isolating and probably then get a PCR test, and that would be a confirmatory test. You might have heard that these kids are not reliable. There are false positives in that. But if you look at overall, this has been very helpful, and it helps people to identify their symptoms on early stage, easily accessible when PCR testing is a little bit stringent based on the conditions. So I think it is much better to get whatever supplies you are getting access to. For example, RAT test. So get access to RAT test, do a RAT test. If it is positive, yes, you can go and get a PCR testing done. If if it is not positive but you still have symptoms, it is always best to assume that you are positive and isolating. So that helps in general in having like saving the family and the friends from the spread of COVID.
Yeah, thank you for that all that information. I'm really glad that we are reminding these people about this information and just keep on reminding it. So we know we're going to be living with virus. We don't know how long. We know everything coming back to live, everybody coming to in-person in events and all that stuff. So how do we protect these people?
So right now, the best way is basically to get your vaccine shot. So vaccine is the number one way that is recommended to avoid getting COVID, right? Now, because these vaccines are recently developed, usually vaccine development takes time. You know, like if you look historically, vaccine developments take anywhere from 8 years to 10 years so that people can learn about a little bit long-term effect of vaccines as well. But this has been evolved very quickly, and it's a new form of vaccine as well. So the vaccine does help, but at some point of time it loses its effect. That's why we are having a series of vaccines to support us. So we have primary series, and then which is supplemented by first booster and second booster. So vaccines are number one. Second is masks. So I would still recommend having masks on because masks give you a layer of protection. This infection is when it was identified as droplet, but over the time it was also identified as airborne transmission. So masks definitely help. And as you said, we never know who is symptomatic, who is asymptomatic when we are in a gathering. So it is difficult to keep ourselves safe without masks. So mask is definitely helpful and help us prevent getting COVID infection and also spreading COVID infection.
That's true. When we have like a people that are in person, I know it's hard to do a social distancing, but as much as possible, we have to sort of keep that in our mind and then keep on washing our hands much as possible. So those are the things that we need to keep in mind.
Absolutely.
Yeah.
Thank you, Murshida.
So thank you for that. So as you mentioned, these number one series and the boosters that will help. So what is the benefit of getting these vaccine into our body?
So the benefit of getting these booster is basically, or these vaccines is basically training our immune system against this virus. So what happens is, as everybody knows, this virus has spike proteins, right? So what the vaccine does is, I'll talk about the recent mRNA vaccines. So they take a part of spike protein and decode the genome sequence, and they work with the RNA. And so once we find the RNA and a vaccine is prepared using that code, we inject it in the body. And what that does is the vaccine goes and attaches to the cell. So when it attaches to the cell, it initiates a sequence of replicating these spike proteins. Yes, photocopying these spike proteins. So what happens when their level goes up? Our body is alarmed, and that's when our immune system starts triggering a response to that. So what happens is once we have enough number of bodies, the immune system will start learning first how to identify them and then generate antibodies, and that those antibodies will attach to these spike proteins and destroys them. So next time, so this was the training of immune system for the first time. So what happens next if we ever get an infection and it has the same spike proteins? As soon as they come into the body identify those as foreign material, and then they start producing antibodies quickly so that we do not have illness or fever for a longer duration of time. And that's how our body gets trained to a triggering immune response in case of COVID infection.
Okay. So thank you for that explanation. But we know how people are thinking this when they get this vaccine. People have this idea of like those vaccine stays in our body. Was there anything that you could touch based on how long does that vaccine stays in our body, or
So as we see, and as the government is recommending multiple shots, so that means this vaccine is weaning off, right? So over uh, the government is recommending 5 to 6 months time for the doses to get optimal responses. So I think around that time is the time when we have antibodies in our body, and then they help fight. So I would say around 5 to 6 months is the time.
okay. Would you able to explain a little bit about mRNA vaccine? Is there any
So
better?
all right, thank you.
How does
So
it work?
yes, so mRNA vaccines are the recent version of the vaccines. They are developed very quickly, and because they take portion of mRNA, which is like a code to develop these vaccines, these are quicker. So earlier vaccines, the scientists used to take a portion of the virus or the infectant, and then they reduce the amount of it and then introduce it into the body. So that's how, and then because it was very minimal amount, but the substance that virus or virus has, so that's how our body learned to get them. But in this case, mRNA vaccines are new vaccines. They just take the coding from the vaccine, from the virus, and then they develop vaccines based on that code. So that helps in terms of, because what happens is we are getting that code from the spike protein and not the virus. So the virus is not entering our body, but our body is getting trained.
Okay.
So it's just from that spike. So they, like, our body is trained to attack those spikes. So because the virus has that structure and spikes on top of that, so the body identifies it and start destroying it.
Okay.
So this is how vaccines work, and mRNA vaccines are on the similar lines. It's just working with the mRNA.
Thank you for that explanation. Really appreciate it. So, do you know where? Do you have any clinical information? Do you have like in our community? When is it available for our people to get that vaccine and how to book that appointments?
Sure. So mRNA vaccines are available from last year itself. So both Pfizer and Moderna are mRNA vaccines, and they are available in the community. For example, we are running vaccine clinic at 40 Oak Street. We were, when we started, we were running 6 days a week, but now the numbers have gone down. So we are just running on Saturdays from 9:30 to 12:30. We also have clinic at the 519 from 3 to 6 p.m. on every alternate Wednesday. We also have a sister clinic, which is at the corner, 200 Wellesley Street, who's also supporting vaccination in the area. So, and I think Regent Park is also running clinics on Thursdays from 1 p.m. to 3 p.m. So these are some of the clinics which are running around in the community and are static. So if anyone needs access to these clinics, at this point of time, they are accepting walk-ins as well. So it would be good if anybody needs a vaccine, they can walk into these clinics. So yeah,
Oh, thank you.
that's
Thanks for that information.
no worries.
So, um, thank you for that. So we know that COVID exists and then people have it, and then what about like some people? It doesn't. They don't get rid of the COVID. What is long COVID and or post COVID conditions?
Right. So some people still experience physical or psychological symptoms more than 12 weeks after getting COVID-19. So this is called post COVID-19 condition or long COVID. Uh, this Their symptoms can be different in different individuals. There are over 100 symptoms under this. So this, like, if people have symptoms, uh, not feeling well, it is very common to have post COVID-19 infection or condition or long COVID.
Can these people affect others?
So when we get COVID, we are infectious for first 7 to 10 days, right? And after that, we are non-infectious. So this long COVID is not COVID-19. So if we understand that, that means the people who already had COVID, these are the remnant symptoms of COVID, right? That are dragging along the way, but uh, they are not as such symptomatic unless they are reinfected. So there is a possibility that they may get reinfected or a second infection or a third infection, and at that point of time they will again be transmitting virus for the first 7 to 10 days when they get infected. But otherwise, long COVID does not have like it is not contagious.
Thank you. Does how does this work with the like? Is there a differentiation with the adults and then children?
Yes, so it affects different population in different ways, and that affects everyday work, so activities of daily living. The common symptoms with adults is fatigue, memory problem, sleep disturbances, shortness of breath, anxiety, depression, general pain and discomfort, difficulty thinking or concentrating, and PTSD. These are some of the symptoms, as I mentioned. Like there's over 100 symptoms that comes under the category of long COVID. The most common symptoms that we know in children are fatigue, shortness of breath, lack of concentration, cognitive difficulties, headaches, abdominal pain, muscle aches, joint pain, and sleep problems. So there's still a lot that we don't know about long COVID because this is pretty recent, right? Especially in children. So there's a lot of research going on with different populations to analyze, and hopefully we'll get to know more about the estimates as the new evidence emerges.
So how do we avoid this long COVID?
So I would say to avoid long COVID, the best way is to get your vaccines and to avoid infection. So what the best way to avoid infection is get your vaccines, right? Second is using masks. So use masks. So that would help you to not acquire COVID infection, and stay up to date on the vaccine course, because as I told, the vaccine does wean off after some time, 5 to 6 months. So I think as whatever the government recommendation from government and NACI is, we need to follow that. That would help us. So if you don't have COVID, you don't have long COVID. It's just as simple as that.
Okay. So as you know, like all the COVID and the lockdowns and everything, people have been staying in the house for long. Now everything is open. The people have been trying to travel places and everything. So how is safest to travel, and then what are the things they need to look after?
Right, I do hear you. That's a pretty common observation, right? Because things have been opening up, and people are so sick and tired of isolating in their homes, so they started traveling. Um, Even if you ask me, I would say if it is a non-essential travel, avoid it, right? Because even now, the virus is evolving. We have had so many strains, right, from Delta to Omicron, and then the sublineages of Omicron as well. So the virus is also evolving. We are not seeing more deaths. That does not mean that virus is not there, because vaccine is working. People are not uh, ending up in ICUs or having hospitalizations. That does not mean virus is not there. Virus is still there. So I would say avoid all non-essential travel, and if you have to, probably the best way is get vaccinated and use masks.
Okay, thank you for that.
Distancing, if you can, that's amazing. If not, masks and vaccination are your
The best way
helpful
is to
tools.
travel, just to
Yes.
protect yourself, and we don't know what's happening in another country and how they protect it. And thank you for that. And then COVID vaccine. I wanted to ask you about like some things about the kids. We know that COVID, it doesn't affect as much as adults. They can recover. So how safe is that for the kids? Let me ask you by asking this question.
The vaccines
The vaccines for the kids.
for the kids. So, can you be specific? Like, are you
Like
talking about
specific mean
under
like
5 or 5 to 11 population?
5 to 11 population.
5 to 11?
Well,
Okay.
if
Yeah,
it doesn't
sure.
affect them too much, why should I give them the vaccine? And then if they can overcome the
Right.
sickness, right?
So you need to also understand the dynamic of the society. Um, so first of all, I was looking at evidence. I just like last week I made a presentation to Project Management Institute, and I had a graph showing age-wise distribution of COVID cases, and pretty much from 0 to 99, every age group in the decades is affected. So first of all, what does this mean is COVID can happen to anyone,
Yes.
right? So if it can happen to anyone, the best measures we have to protect the severe health consequences of the illness is by vaccination, right? So that's why government started vaccinating kids. Not everybody in that population is healthy. There are people who are immunocompromised. There are children who need medications to support, and otherwise also like people children might have childhood illnesses, asthma, like asthma and others. So it is helpful to have vaccination and decrease the severe health consequences. Second, when you understand the social dynamics, uh, children live with family now that has uh, father, mother, probably grandparents. If children are not affected much, probably they can transmit to their parents, they can transmit to their grandparents, who will be at higher risk of getting these infections and uh, getting severe health consequences, right? So it is helpful to have a herd immunity. So that means if 95, 85, don't get my number, but just giving you an example, if 85 people out of 100 is vaccinated, the chances of spreading of that infection is very low, versus where only 50% is vaccinated, right? So virus does have more routes to escape from one person to another person and transmit. So that is why uh, for a society it is also good to have a better herd immunity, so that when the immunity of all the people, most of the people in a particular settings in a particular neighborhood is high, it is not very likely that the case rate will go up or the severe consequences will go up.
Thank you for that. So I was going to ask you another question. I think you actually covered my question, saying that the reason we should get our kids get vaccination just to protect our elders, our parents, people who's vulnerable for health immune system. And thank you for that thing.
And
So-
themselves.
And then themselves as well. Thank you for that. And is kids under 5 is eligible to get vaccine?
So, US has approved, so the FDA has approved vaccines for kids under 5. Health Canada, the submissions have been made to Health Canada. So, I think today is the day when first kid under 5 got his vaccine. So, we will pretty much be hearing soon enough about the vaccines. But yes, I this is my assumption that they will be coming soon. As US, the FDA has already approved. It is working. It is going through in US. In Canada, it is coming.
Okay, thank you for that. So we all know about the things, and then we know that there's a first dose of vaccine, and then there's like a booster dose up to.
Right.
Is there another doses available for people that who's vulnerable? We know that who's vulnerable can take the fourth dose. What about the rest of the population?
So, okay, coming to the fourth dose, yes, fourth dose has been opened for general public starting today.
Okay.
So that means people 18 and over can get their fourth dose, and the time interval is minimal 84 days apart. So this is the minimal eligibility to get your fourth shot. But at the same time, it is recommended and advisable that if we get your fourth shot or the second booster after 5 months. So that would be around 150 days. So that would generate an optimal response, optimal immune response, and it will be helpful because we do not know how many more vaccines do we need. So it is better to space those vaccines out. So
Okay.
that will generate an optimal immune response and give us a protection for longer duration compared to if we get it earlier.
Okay. Is there anything additional thing that you want to add on to that? We're coming to almost our end of our session.
No, I mean, I just want to let everybody know that vaccines do work, and just look at the evidence on which is available through genuine sources, and then you'll come to know that the rate of hospitalization, the mortality, the death rates have come down when overall the immunity is going up in the community. Again, the case count is going down. So vaccines do help. Keep yourself safe by having the vaccines, using masks, and just a heads up, we still need to exercise precaution because pandemic is not over.
Thank you for that. Yes, vaccine do help with especially with our senior population. Our deaths are gone down, and then they're allowed to. Right now, they were able to go out too instead of they staying in the house. And yes, thank you for that information. And then, as I say that, we know that there's another viruses out there which is called monkeypox. Is there any information you could give us on our next session?
Monkeypox, you're right. Monkeypox, the case count is going up. Toronto Public Health is running a vaccine clinic. We are also running a vaccine clinic on coming Saturday, which is July 16th at 40 Oak Street for monkeypox. However, there is a very stringent criteria for monkeypox. Not everybody is eligible. I do not want to go into the details, how does it spread as of now, but I will definitely try to bring a subject matter on monkeypox to discuss more on that.
Okay, so thank you for that. I really appreciate your
Thank you so much, Murshida.
information. As I was saying that, and I want to really thank Abhishek for all this information to educate our Regent Park population. And please, if you need a vaccination, please go every Saturday. The clinic is open, 40 Oak Street. Please do. If the walk-ins welcome, you guys can have the vaccine, as well as on Thursdays from 1 to 3 is available on the Dundas and Parliament clinic. And please, if you guys need the vaccination, please do walk in. And as I was saying, and then our Vision of Science will be hosting a first public in-person event for the youth and the families, science, technology, and engineering and math, while they're providing the space for representative STEMs and students and research for the share and their research as well. And please get their information from them, what sort of how they're running and who can be participating there. And the event date is July 23rd from 1 to 5. And please register, go into the Vision of Science website and register for the event. Thank you.
Sorry, I would like to add one more point that Regent Park Community Health Center has a website. For updated information on COVID-19, please do visit Regent Park Community Health Center's website. They also give you a pathway to book your appointment for the vaccine clinic. Thank you.
Make sure to like, comment, and subscribe. And when you do subscribe, hit the little notification bell so you never miss out on any of our content. If you'd also like more, you can find us on our other social media platforms. And if you want even more, you can look at our website.